motherhood. Now you'll hear from my colleagues and advocates as we introduce the maternal health equity agenda. I'm proud to introduce the co-host and maternal health champion, Senator Lea Webb, to discuss our unwavering commitment to protecting all moms. Thank you so much.
I want to extend my profound and deep appreciation to Assemblymember Anise. You know, she, as a mother, she is doing a phenomenal job in advocating for other mothers, not just in the Assembly, but for many families across the state. So can we give her a round of applause, and a beautiful, beautiful munchkin that's here with us. I want to thank all my colleagues that are here as well, and I'll keep my comments short. As the chair of Women's Issues, this year we introduced a 12-bill package on the anniversary of Roe v. Wade, and this package deals with maternal and reproductive health care access. As has been shared, that this is Black Maternal Health Awareness Week, and it's been around for the last 7 years. One of the things I also wanted to lift up is that the theme for this year is Our Bodies Still Belong to Us, Reproductive Justice Now. And so when you think about that theme and all the work that we're doing in the state legislature, I am not a mother, but I am a proud auntie. and so, again, understanding the importance of having community supporting all birthing people is very important. And so I'll lift up a couple of things that we've been working on. We actually have, in this context of trying to address the maternal health crisis, as my esteemed colleague in the Assembly already mentioned, I have a bill that was a part of the 12-bill package to actually establish a maternal health working group. Because we know these disparities exist, we want to develop strategic initiatives to really break down the structural failure, because these kinds of statistics are indications that it's not a one-on-one issue, it's a structural failure. And that means that we have an obligation and responsibility, not only as elected officials, but also as practitioners, and we can change it. The other piece I want to lift up before I turn it over to my colleagues to speak is that if you are expecting, one of the bills that we've introduced is a pregnancy app. This is an app that will help you, give you well-informed information to help guide you during your pregnancy journey, pre and post. And so again, these are just a few of the measures. As it's been shared, there are so many glaring disparities right here in New York, and it is imperative that as a state, that we not only take actions, continue to take actions in our current legislative session, but we also have to ensure that once these policies we pass, we want to ensure that they're equitably implemented. And so we need our midwives, we need our doulas, we need our nurses, we need our doctors, OBGYNs. We need the community alongside us as elected officials to ensure that the implementation is happening. And so this is not an issue we can afford to say, well, if we don't talk about it, it goes away. It does not. In fact, people are literally dying all because of their decision to bring a child into this world. And that decision should not be you shouldn't be put in medical hazard or any type of dangerous way just because the color of your skin is a little more extra melanated. So I think it is imperative that we continue to raise awareness, that we continue to expand access to these important resources and services. And so with that, I'm going to turn it over to my colleague who actually is introducing today in the Senate, and that's Senator Roxanne Prasad, to say a couple of words. Thank you.